Dermatology and CRM Coordinator to welcome the gathering.
Good morning to all. It is a privilege to deliver this welcome address today. At the outset, I'd like to welcome our medical superintendent, who is dean in charge today, Dr. Satish Kuruvula. Thank you, sir, for coming here. I would also like to extend a warm welcome to our chief guest, Dr. Akram Ahmad. We thank you, sir, for accepting our invitation. Sir is the CEO founder of Academically Proprietary Limited. I would like to extend a very warm welcome to our Vice Principal, Administration and Students Progress, Dr. T. Rajan. Sir has the welfare of the students close to his heart. Thank you, sir, for coming here today. I would also like to welcome Dr. T. Prasad, IQAC Coordinator and Professor Community Medicine, Dr. Narayana Swamy, Placement Officer of AVMC and Associate Professor of Pharmacology. Thank you for coming here today. To all the other faculty, Dr. Kumar, warm welcome, and a very, very warm welcome to the students and the CRMIs, without whom this program cannot take place. I hope you benefit. Thank you so much.
Now, I would like to call upon Dean in Charge, Dr. Satish Kuruvula, with great honor to give the inaugural address.
Good morning to all of you. Special thank you to all the dignitaries on the dais and to all of you who are sitting here. I think we've already got our first lesson for the day, and that is Indian law.
I think I'm loud enough. Anyway. Okay, fine. I think we got the first lesson for the day, and that is don't stay at the back, move to the front. And that applies to your career also. Now, as people are coming in slowly, I would say that if you miss today's lecture by Dr. Akram Ahmad, it is likely that there is quite a significant bit of counseling for your career that you would be missing today. When we were at your stage, or probably even 3 or 4 years earlier, 90% of the people knew only 2 careers. One is engineering, one is medicine. And today, even under medicine, there are hundreds of subspecialties and various other opportunities that will help you be in the forefront of your specialty or field that you choose to take. And I'm sure as we go along, Dr. Akram will enlighten you about the options and would also help you clear your doubts about what is there to unfold today. Now, the privileged lot that you are, I would say, stay tuned and do not hesitate to clarify your doubts as the session goes on. Thank you. Thank you, sir. I would like to call upon Dr. Prasad, Professor, Department of Community Medicine and IQAC Coordinator, to introduce the guest speaker, Dr. Akram Ahmad, CEO and founder of Academically Private Limited, Sydney, Australia.
Very good afternoon to all. I feel elated to introduce our guest speaker for today, Dr. Akram Ahmad. He is a PhD graduate from the Faculty of Medicine and Health, University of Sydney, Australia. Currently, he is working as a burns researcher, research manager at the Children's Hospital at Westmead, Sydney. Previously, he was a pharmacy academic and he has taught pharmacy practice and clinical pharmacy at UCSA, University Kuala Lumpur, Malaysia. His field of interest includes medication use optimization, patient preference and adherence, drug safety, pharmaceutical education, pharmaceutical policy, encompassing about access and affordability of medicines, quality of medicines in community and health economy. He has got active research collaboration with many number of universities all over the world. A few to name are University of Sydney, Boston University, University of Huddersfield, University of Virginia, Marshall University, and so on. He has published more than 110 papers, books, and book chapters, conference papers in all high impact factor journals. He has a total of 200 plus impact factor points and 2,200 citation and H index of 25. He is a recipient of the most best promising researcher award from the UCSA University in 2016, and also the recipient of the International Postgrad Research Scholarship and outside the Australian Postgrad Awards from the Australian government. He is a recipient of the Fast Track Permanent Residency Visa to Australia's Global Talent Independent Program. His profile is rated among the world's top 5% scientists on ResearchGate. He is the founder and CEO of Academically, which helps qualifying health professionals across the globe. And he is also the editor-in-chief for the Journal of Pharmacy Practice and Community Medicine. With these few words of introduction, I would like to
Hi, Suman. I think there is some network issue.
हेलो सर
Yes. How are you, Suman? क्या चल रहा है सब?
सर आई एम डूइंग गुड अभी तो वही सब रजिस्ट्रेशन के लिए महीना खत्म हो रहा है हैव टू कंप्लीट द टारगेट
No, it's okay. अच्छा, वो अभी जो लड़की है मदीना से बात हो रही नहीं हो रही?
हाँ हो रही है
ओके, तो उससे टिप्स लो, वो चीजें उसको एक्सपीरियंस है बहुत, उसने बहुत सेल किया है बेसिकली बीटीसी में.
यस सर आई एम इन लाइक टच विद हर
ओके ओके.
सर आई गॉट अ कॉल अभी एम आई ऑडिबल सर
यस यस सुमन.
तो सर एक कॉल था वो ऑस्ट्रेलिया से है बेसिकली उसका नाम उसने अली बताया एंड ही इज सेइंग दैट कि उसे किसी से मिलना है हमारे ऑफिस से रिलेटेड ही वांट्स टू गो एंड मीट लाइक इन ऑस्ट्रेलिया इटसेल्फ व्हाट एम आई सपोज्ड टू डू
हाँ, उसको बोलो काम, ही इज अ स्टूडेंट, ही वांट टू एनरोल इन द कोर्स.
maybe not sure of that but he just said कि उसको मिलना है
हाँ, तो जो बोलो वेबसाइट पे जो एड्रेस दिया हुआ है, ही कैन कम एंड मीट.
हाँ
उस
ओके
एड्रेस
और
में
वेबसाइट पे जो नंबर है और
नो,
he is
वो मेरे
saying
नंबर
कि
पे.
वो कॉल नहीं लग रहा
अच्छा अच्छा, उसको बोलो उस नंबर पे व्हाट्सएप करे उसको
अच्छा
बेसिकली. हाँ यस, मैं इस वेबिनार के बाद में थोड़ा सा मैं आपको बताता हूँ क्या करना है. ठीक है, इन जनरल अगर कोई मिलना चाहता है तो उसको बोलो यस यू कैन गो एंड मीट अक्रम से. और स्पेशली इसको बोलो अगर आप
ओके
2 बजे से पहले आते हो तो इट इज़ बेटर फॉर अस बिकॉज जैसे यहाँ पर इंडिया में जब 2:30 बजते हैं ना, मतलब
हाँ
ऑस्ट्रेलिया में जब 2:30 बजते हैं तो इंडिया में 9 बज रहे होते
हाँ
हैं.
हाँ
जब जब आप लोग काम
हाँ
स्टार्ट करते हैं 2:30 बज जाते हैं, तो उससे पहले कोई भी आता है तो मिल लेता है वहाँ पर.
ओके सर
तो ये सुमन कहाँ पे आया था ये
ये मेरे को कॉल ओजेंडल से आया था अभी अभी
ओजोन टेल. ओके, ओजोन टेल बेसिकली अभी आपके लिए हम लोग अलग से नंबर रहने वाले हैं B2B का शायद आजकल में.
हाँ हाँ हाँ
फिर वो आपका सेपरेटली हो जाएगा, तो जो भी कॉल आएगी वो फिर B2B की नहीं आएगी, मतलब आपके डिपार्टमेंट के पास ही आया करेगी वो.
यस सर
यस, वो बोल रहा है सर रिकनेक्टिंग नेटवर्क इशू. हाँ Yes, Abdul, now we can hear.
Yes, sir. Is it audible, sir?
Yes.
Yes.
Can I start?
Yes, sir. You can just present the screen, sir.
Okay.
Yeah. Sir.
So you can start, sir.
Okay. Thank you so much. Abdul, are you able to see the screen?
Yes, sir.
Okay. So, hello everyone. My name is Dr. Akram. I think sir already gave me my introduction, a long introduction. I'm not going to in this. But today I'm going to discuss regarding the opportunities for you in Australia in general, this presentation. But at Academically, we provide the assistance for PLAB for UK, AMC for Australia, and USMLE for US. Okay. So in general, so there are two aims for you. Some might be want to go for PG. So if you want to go PG, directly you can go USMLE. That can be a good pathway for you. Or some might be want to work. You want to earn. You want to earn is part in the money. In that case, you can choose this AMC is the best pathway, and then PLAB. AMC is number one. Then you can think about PLAB. I can give you like some comparison as well. So if you have any questions regarding PLAB, AMC, USMLE, or in general in these three countries, so you can discuss. Or if you are looking some other countries or something, so basically you can ask me at anything. So last 6 years, I'm trying to create the awareness among Indian medical doctors to migrate to Austria or other countries. So I always make content on YouTube and apart from my normal job. So Academically is an Austrian company, and right now I'm basically presenting this presentation to you. This is very lovely weather is here in Sydney. So and we provide assistance for medical doctors, dentists, pharmacists, nurses, lab technicians, physiotherapists, veterinary doctors, optometrists. So any healthcare professional looking to migrate or looking to register themselves in another country. So in general, there are 3 steps they need to complete. First step called document verification. Okay. So any country you want to work, you have to do document verification, whether it is like UAE, Saudi Arabia, any Gulf country, or you want to work in Australia or UK or US. Documentation process, the first step. Then you need to write some exam. For example, in case of Australia, you need to write AMC exam, Australian Medical Council exam. In case of UK, you have to write PLAB, or US, you need to write this USMLE. Okay. So, and then you also need to pass English proficiency test, and then you can register yourself as a healthcare practitioner here and can start working. So these are the general 3 steps you need to complete in order to migrate any country worldwide. So this is also already given. This is some of the faculties. So this is Indian faculty, Dr. Shipnil Sharma. She is MBBS MD from Pune Medical College, and she passed this AMC exam. This all this journey. Currently, she is working here, one of the hospital in Sydney. So she is living and working right now in Sydney, but she is an Indian citizen. And another Dr. Udara, she is a Sri Lankan citizen. Earlier, basically, now they are Australian citizen, basically. So she also passed this AMC journey. She's also working here in Sydney. Then we have Anamullah Khan as well. So they are the three faculties apart from this for this AMC, basically. And so the opportunities for you as a medical doctor. So if you see, this is a AMA report, Australian Medical Association report, say there is a lot of shortage of these GPs. So they need around 10,600 GP by 2031. So Australia provide PR visa, permanent visa. You can live and work permanently in Australia. 190,000 every year. Australia government give this visa. Okay. And currently there are more than 10,000 job vacancies are available in Australia. And on an average salary for a GP, around we can say 2 CR per year. Okay. And this is also, you can see here, this is one of the website called seek.com.au. This is #1 website in Australia if you are looking a job. Okay. So they mention based on the recent advertisement, these are the salary for a GP in Australia. So in general, what is the salary in Australia as a medical doctor? Okay. So for example, if you just completed your MBBS from India, or you just pass AMC Part 1. There are two exams you need to pass, AMC Part 1, Part 2. I will explain you in my next slide. So after that also you can work in Australia. In that case, you need to work as a JMO, Junior Medical Officer. This is same like in India when we are doing internship in our MBBS. Okay. So you are not legally allowed to prescribe medication or give the prescription to the patients, but you can work under the supervision of other, other healthcare practitioners. The same is here. You have to work under another RMP in Australia. So, but you can assist them as a JMO. So JMO in general, the salary, this is kind of a stipend. This is not a salary, basically, I can say. So around 4 to 5 lakh per month in general, and some might be have some experience. For example, you complete your MBBS and you have 6 month or 1 year experience after that, they might offer you RMO. So GMO or RMO, both are you are eligible to apply once you pass AMC Part 1 exam. Okay, and for that, this is a fixed salary, 20,000 per year salary. This is for basically 9 to 5 job for 5 days. Okay, and if you are working in Saturday or after hours means after the 6 p.m. or 6:30 or 7 p.m. right, in the night time, if you are working, you will get the 1.5x salary. These are rules in Australia in general. Or if you are working in like public holidays or Sunday, you will get a 2x salary for that particular day. So this is the salary structure in Australia. Apart from this, once you become a GP, so how basically what are the calculation to earn basically the fees, or we can say the money in Australia. So in Australia, legally, you can see maximum 60 patients per day to maintain, this we can say quality. A lot of things they have to check. So they are just allowed 60 patients you can see here per day, maximum in Australia. But in India, in general, if you go any CSC or PSC in India, you might be seeing, especially in UP, Bihar, might be 200 patient or 300 patient have to see one doctor there. So here you can see 60 patients per day, and because here the government funded system healthcare, so you no need to charge anything to the patient directly. You just need to see the patient and you have to charge this bill to the government, not to the patient. So government pay for per patient to you as a GP, you will receive 21 to $250 per patient. This is also based on the, uh, uh, what are the procedures you are performing, or what kind of disease, all those things involved in that. So on an average, you have to work for 30 to 40 hours for 5 days. So in Australia, GP, it is a specialist pathway. This is a specialist particularly we also call it like family medicine. So once you pass AMC 1 and 2 and then 1 year internship, then you have to choose what you want. If you want to go clinical, for example, you want to become a surgeon, or you want to become an internal medicine or pediatrics or any other branch, or you want to go for GP. So GP, in the sense you don't want to take much headache in your life and you just want to relax 9 to 5 job, so you can go for GP, general practitioner. This is a 3 year residency program in Australia, and easily you can become a GP in Australia. This is a very easiest pathway to become GP in Australia. So in that case, on an average, minimum I can say, if you are seeing that at least 40 patients per day, and you are getting $30 per patient you are charging, so at least you can make 1200 AUD per day, and on an average I can say like 12 to 13 lakh per month easily you can make. Okay, so but this is very minimum I'm calculating. But if you are in general, doctors earn a lot here in Australia. And if you see top 15 occupations in Australia, so number one in the surgeon, especially the neurosurgeon, they make up to 600,000 per year. Okay, then the other surgical specialties, then anesthesia, and then the other, I mean, internal medicine and optometrists, all those things. So these are salary structure in Australia, they calculate basically. And this is, I mentioned here, this is for a, once you pass AMC part 1, then you are eligible to apply, and then on an average salary you will get 108,000 Australian dollar per year. There is some other better advantage to migrate Australia. It is not just the money you are looking to, so education for the kids are free in Australia. So for example, if you are married, and you have family, so no need to worry about, their education. So education system is very, very good in Australia. The top universities in Australia, I can say, I'm graduate from University of Sydney Medical School. Some of you might be know. These are 13th rank in the world, this medical school. Right, so they're top medical schools here in Australia. So education is free for kids. Even once you got PR and your spouse, for example, your husband or your wife also want to study, so at very, very low cost, he or she can do the other course and upgrade themselves. And healthcare access is free in Australia. In case of US, you need to buy insurance there, but here in Australia, no need to buy anything. It is free from government side. And then professional development. So as a doctor, if you want to update or upgrade yourself, so you want to do some short course or some training you want to attend, or maybe you want to present some research or something. So in that case, the hospital encourage you at least yearly 2 times you can go, and all the expenses bear by the hospital. And work-life balance, as I mentioned, you need to work around 38 to 40 hours weekly, 8 hours per day for 5 days, especially if you are a GP. Obviously, if you are working in emergency, then there is no these hours, the days are not applicable for you. Might be the night time you also need to work. And career opportunities, I can say, very high demand in Australia, especially in the rural or regional Australia. Quality of life, obviously, here in Australia, a lot of people are migrating from UK. So maximum doctors, they are working in Australia, they trend in UK and New Zealand. And nowadays, I can say like 4th or 5th rank, we are Indians. So a lot of Indians also, you will find a lot of they are working nowadays. And of course, high potential earnings. So these are some of the factors you can consider when you are looking to migrate to Australia. So these are some steps you need to complete in order to migrate to Australia. The first step, we can say in simple words, this is a documentation process, document verification. So we will help you to complete behalf of you. So no need to worry about this. You have to do basically epic verification plus AMC portfolio, and these are the fees you need to pay directly to them. And it may take around 2 weeks to complete this process, documentation process. At least 2 to 3 weeks will take. Okay, and then you have to go for this part 1 examination. It's called Australian Medical Council MCQ examination. So there's a question in MCQ base. You can give in your home country this exam. And once you pass this plus English, then you have to apply for your limited registration. Means you are allowed to work in Australia, but under the supervision. Okay, and once you and then you are allowed work in Australia as a junior medical officer or agent medical officer, GMO or RMO. You can work as I mentioned earlier, or the salaries. So once you've done this, then you need to write AMC Part 2. So these 3 steps you can complete in your home country. In India, you can complete these steps, but this final step you need to come to Australia. Okay. So here you need to pass AMC Part 2. So many students basically this ask me this common question, sir. This is the what is the passing rate for AMC 2? Okay, so passing rate is about 25 to 30% for AMC 2, and AMC 1 is about 60 to 70% student pass in the first attempt. So, is there any alternate for this AMC Part 2? Yes, there is an alternate called WBA. This is called work-based assessment. So you have to work in that hospital, same like you are doing internship in India currently in your MBBS, right? So similar that you have to work under the 4 to 6 basically different departments for 1 year, and this staff will observe you. They will give you the report, and in that case, no need to write this AMC Part 2. So WBA passing rate is about 99%. So no one failed in that exam. Otherwise, you did something, blunder in the hospital and no one is happy, from your services. In that case, might be happen, or otherwise, you will pass this easily, the WBA program. I also highly recommend it. Once you pass AMC Part 1 plus English and start looking a job as a GMO or RMO in those 19 hospitals. So for WBA, Government of Australia, or we can say Australian Medical Council, they identified 19 hospital only. Those 19 hospital allow to do this WBA program. So in WBA program, the length around minimum 8 months. Okay, but generally, as I mentioned, that demand is very high and supply is very low. Medical doctors in Australia, so they at least want you to be in hospital at least for 12 months. Then only you can complete this WBA program in practically, but theoretically they mentioned that it is 8 to 9 months. Okay, and then you will get full registration. And now this AMC or APRA, they will see your case individualized case. Okay. For example, someone completed MBBS or maybe PG also in India. In that case, they might say that you have to go for 6 month training further. Or someone is a fresher MBBS, they might say you have to go for 1 year, 1.5 years. Okay, because some graduate might be from like Russia, China, or those countries. No, they are not from India. For them, they might recommend to go for 2 years also. Okay, this is like individualized, but we can say in general, anyone did from MCI recognized MBBS from India. I mean, from then in that case, mostly you will get 1 year training. Okay. So this is a called WBA Work-Based Assessment Program. So you can see here is the government of Western Australia website. You can have a look there. So only they are asking you pass this exam, and they are asking you have at least 12-month employment. So these are asking them this applications. So those are pass AMC Part 1. They can apply for this. These are some of the I think lot of links is here. I think Abdul will show you after this. Maybe he will also can explain you in your own language. So I'm not going to show you, but these are the government websites where you can find a lot of jobs are available once you pass this AMC Part 1 exam. Okay, these are the government website. I'm not talking about any private hospital they are hiring or any clinic is hiring. I'm talking about the government is hiring. So these exams you can write 10 times in a year. Whenever you are ready, you can just write this exam. But in case of lab, We provide coaching for PLAB, we provide for USMLE, we also provide for AMC. So I'm not like something biased. I'm focusing on AMC. The fact that in PLAB, the when you want to book the exam, you have to book at least in advance 12 months to 18 months before. There is a long queue to give this PLAB exam, and same for USMLE also is not very easy to get the residency nowadays. So there is 15 exam centers currently in India. So exam center is not a problem. So whenever you are ready, you can write this exam, and except December or January, throughout the year, you can write monthly once they conduct this exam, AMC in India. Okay. And in English, you need to write to IELTS you can write, or OET or PT. So any medical professional, highly recommended go for OET. OET is very easier because this exam is for you only. This exam is created only for healthcare professionals, occupational English test. So this is an easier exam. So if your score is coming 6 in IELTS, 7 you can score in PT or OET. If your score is coming 7 in IELTS, you can score 8 in PT or OET. These are the easier exams for you. But it's up to you. Some students say that IELTS is easier for me. So it's up to you. So you can give IELTS or OET or PT. So IELTS required 7 individual band, OET required B band, and PT required 65 percentile. And for documentation process for this, you required to submit your degrees, transcript, work experience if you have any. Work experience is not mandatory. And valid passport, government ID proof, passport size photograph, and medical registration. Okay. And so for this exam, there is a 150 multiple choice questions, and there is a 3-hour time. So 60 minutes for 50 questions for you. And around in this exam, there is a scale basically 0 to 500, and you need to score 250 out of 500. Around, we can say 50% you need to correct. And some questions might be they do not have any basically the score. Some questions have the higher score. Some questions might be have a lower score. So as a candidate, you don't know. The system will automatically will see your how much percentage you pass this exam, and no negative marking for this. So I can say very good passing marks for part 1, up to 70% student pass this. At least minimum 50% always for this exam, and max 70% student pass. In between, always this result for AMC part 1. We will provide you the coaching for 4 months for this, including the revision for AMC. And once you pass all these process, then you are eligible to apply PR visa, permanent visa, like 190, 186, 189 in Australia. And some work visa also you are eligible, like 482, 494. So here also very important. So any PR visa, if you want to apply in Australia, your age must be below 45 years of age. Okay. And for work visa, there is no age conditions. They are some of the basically media coverage regarding about me and about Academically. Yeah, these are the, I think Abdul will give you more information. And we provide the loan options. So you can pay the fees, our fees, in 3 months, 6 months, 9 months, or 12 months, without paying any interest. So I do not, if you guys want me to explain more about USMLE or PLAB, I can. Or otherwise, you can ask me any questions regarding this.
So thank you very much, sir, for enlightening our students with the salary package as well as AMC 1 exam and AMC Part 2 exam, sir. Now the forum is open for discussion. So Mr. Abdul Rasat, the Senior Academic Officer, Tamil Nadu and Pondicherry region, is also here to clarify your doubts.
If you have any doubts, you can directly interact with Dr. Akram. You can come front and you can have a discussion.
Yes, guys, you can directly to ask to me. I mean, directly maybe some questions, regarding PG or anything in your mind, or you can just clarify with me. Abdul is here. He can also clarify.
யாராச்சும் ஹையர் ஸ்டடிஸ் பண்ணலாம், அது ஸ்டடி போடாமா, வேலைக்கு போடாமா, அந்த மாதிரி டவுட்ஸ் இருக்கவங்க சார் கிட்ட உங்களோட கிளாரிட்டி கேட்டுக்கலாம். ஸோ ஆஸ்திரேலியாவில் போய் நம்ம ஹையர் ஸ்டடிஸ் நீங்க ஒரு இந்தியன் சிட்டிசனா பண்ணோம்னா you need to invest 50, 60 or 70 lakhs or even 1 crore.
ஸோ இந்த மாதிரி எக்ஸாம் எழுதி நீங்க ஆஸ்திரேலியால போயிட்டு ஒர்க் பண்ணிட்டு இஃப் யூ ஆர் கெட்டிங் எ பியர் விசா, உங்களுக்கு அங்க ஹையர் ஸ்டடிஸ் நீங்க ரொம்ப நாமினல் காஸ்ட்ல பண்ண முடியும். இதே ஒரு இந்தியன் சிட்டிசனா நீங்க அங்க போயிட்டு நீங்க படிக்கும் போது யூ நீட் டு ஸ்பெண்ட் மோர் தென் 1 year and again you need to write this similar kind of exam to get the registration. ஸோ இந்த மாதிரி உங்களுக்கு ஐடியாஸ் நீங்க இப்போ ஃபைனல் இயர் ஸ்டேஜ்ல இருக்கனால நீங்க சார் கிட்ட அதை டிஸ்கஸ் பண்ணலாம். Any doubts?
Good afternoon to all. Actually, the reason why we conducted this seminar is one is as per the way what they are trying to information gives here. But the idea for me is, see, the for the past 10 to 15 years, what I observed in our AMC is, whenever intern comes to me for NOC, the first question I will be asking is, what is the next plan, right? Around 80% students will say that preparation for the PG, right? 20% students will say that I'm going to work. This is the answer I'm getting the first time when I'm meeting them, right? When they come for the NOC. After 1 year, once the exam's over, right? Again, if I get a chance to call them, or if they call me when I ask the same questions, what the next plan, right? It's ulta, right? Around 80% students are saying that I'm going to work. 20% are saying, I'm going to continue preparation, right? So after 1 year only, everybody knows that there is some need of time for getting the PG, right? So it is understood that we need to prepare minimum of 3 years of the preparation, right? That is evident to the AMC itself, right? If you see the 2016-17 batch, the best outgoing student could not get a PG. The reason is what I can say, her idea is getting passed in the university exam or getting a gold medal or university rank, right? But the same batch, around 10 students have got the PG, right? But they have started the preparations before. This is what happening, where I can say everywhere, the JIPMER or all other institute, they're starting the preparations. Anyhow, so the reason is, one is I should sit for 3 years for the preparation with the totally free mind, right? The free mind mean I should be economically sound, or I should be supported by my parents for this 3 years. Is that right? I don't think that is happening to maximum students. Even though they are well taught, right? Once you have become a doctor, the question is coming to the parents within a 1 year of time. They are getting a degree to you. Why are still depending on us, right? So this is the platform, right? What they're saying here, it's one of the platform. Whenever any students comes or asking me, so what I want to work, but there is a problem for me. I have to get a PG seat also. What I should do? Then I'll give you 3 options for them, right? If you want to be economically sound and peacefully study for the preparations, first to join the JIPMER, MPG, highest salary, 1.5 lakhs. You work for 1.5 lakhs per month, work for 6 months, you'll get a maximum amount. You give some amount for the parents and remaining amount keep it for study. That's one thing I'll say. Second thing I'll say, no, you go to Kerala. There is also highest pay is there. Okay, that's second option. Third option, if you want to be here, go for a double shift, morning on shift, afternoon shift, right? Earn money, then plan for the preparation, right? When Abdul reached me, I thought, why not this information given to students, right? There are 2 options are there in the AMC examination. One is clear the part 1, go there, right? Earn your money, right? And come back here, plan for what I can say, your PG examination, right? You'll have a money, you can manage your parents also. Little bit delayed. Your dreams is getting delayed, right? This I'm not saying for everybody. Who are all already have a knowledge that I can in 1 year if I sit and prepare, I can get me. That is different, right? But majority of students are facing a difficult what I can say. Dream is there, but they are not able to get what I can say PG, right? So this is one of the options. Yeah, other options also there. If you extend this for 1 year there, or if you clear this part 2 and earn much, right? Come back to India without your parents' money, with your money only can join what? PG. Isn't it right? Within a 1 year, you can able to score gain around 1 crore, 2 crores. That is sufficient to get what I can say. Only thing is, you have to get eligibility, isn't it right? The NEET examination, you can join PG, right? Because you all missed one of the important chance during the UG NEET is your parents might be thinking that you will join what I can say government institute, but you joined here. Okay? After doing that mistake again, if you want to do the same mistake in the after finishing MBBS and giving the same burden to your parents, from my side, it's not acceptable, right? If you feel that my parents are having money, they want to give to some of the higher institute education, they let them pay it. I'll go and study that. That means you are you are giving a chance for your parents to spend 2 crores on you, right? You have to think whether that I should do now also, right? So this is another platform. Okay, you can go for there. I'm not saying that you should go, right? There is an option is there. Why don't you think about that? Okay. So you keep in your mind. Okay. There are now I have 4 options to tell to my students. One is Jipmar. It's again difficult to get. The second is Kerala, very easy to get, right? And third one is Oracle double shift. It's difficult to practically manage, right? The fourth one is going to the place where the exam is very easy. And if you see, he's saying that the exam is every month is there, isn't it? Right? Frequently month exam is there. It's not that month exam is coming once in a year, isn't it? Right? So you can keep trying. And second thing is not based on what I can say, percentile. It is based on the what I can say pass. You have to get only eligibility. That's all. So once you get the eligibility, you go there. You can enjoy the foreign country also. You can earn also. You can come back here and you can plan for your PG without depending on what your parents. Okay. So keep all in your mind, right? So from here after, just like, now why I'm called this final year and CRI, because now it's your time to think. Apart from study, your mind is keep on thinking about the university exam. University exams, if you pass sufficient, right? You plan for only passing the university exam. That is sufficient. No one is going to ask you about how much mark you scored in university, or whether you're gold medal or not. Your career will be decided based on your higher study, right? That you keep in your mind. Now, if you have any doubt, you can ask him, right? If you still feel, no, sir, it's not a time for me, I'll go for exam, I clear, one day it will come, right? When I'll understand the situation. That time you give this fellow contact number, I'll call him, right? We are ready for that. So we'll be ready to share all this information through WhatsApp group, right? You can directly also contact him, because in the forum, you may feel that whether the question what I'm asking will be applicable or not, right? So we are going to share all this detail to you, right? You can directly contact him, right? Think what is good for you, right? The main thing is now also burdening the parents is from my side, it's not at all correct, right? You are all now in the position of earning, right? You cannot use your parents' money for higher study, right? So think all those things and keep in your mind. Now the what I can say it is open for the discussion. You can ask questions if anybody is having on this. Still, if you are not having, then you'll share it, and there also you can ask a question, right? Thank you all.
Good afternoon, sir. Sir, we'll for somebody to do that.
Sir, out of AMC and USMLE and PLAB, which of the exams have the highest success rate, like in order of passing?
Yes, so I think PLAB is the highest passing rate, around 70%. But the problem in PLAB, you have to wait 18 months to give that exam. So waiting period is too long, But if we compare like PLAB, then AMC and USMLE, so on an average, 50 to 70% in between only the passing rate for part 1 for all these 3 exams. So if I compare this NEET PG, these are the easier as compared to this NEET PG. NEET PG competition is very high in India basically to get a PG, especially in clinical branch. So highest we can say for PLAB, but you have to wait a long time to sit in the exam.
Sir, so what will be the like total duration of preparation period that is sufficient to clear AMC?
4 months. We provide 4 months basically for PLAB, USMLE, and this AMC as well. So 4 months is enough. So if you can give at least 3 to 5 hours at least per day, and you can clear the exam, because we have very complex syllabus based on this AMC guideline. So yeah, 4 months is enough basically.
So can we give this exam during the internship period?
No, yeah. So this is the main problem. When you are in your medical school, you only can give USMLE, and PLAB or AMC you only can write once you are registered. Actually, you are in RMP in the home country. Then only you can write. So once you complete your MBBS, then you have registration in your state. Then only you can apply for AMC or PLAB.
Okay. Thank you, sir.
Thank you.
So before the registration, you can start your training. The final year. The final year. After training, so that
Getting to the internship. Their internship is not this like a baby. So once you register, then you can start the certificate exam. Rather than the final
Like
exam, then you will pass it on to the exam. Right? During internship, second of the
Thank you, sir. Thank you for a wonderful session with your impressive words, sir. I think, especially for salary, 2 crore per year is not only impressing the students and also faculties. Sir, I have one doubt. Is there any basic age limit for trying to this?
Yes. So basically, some students they join us, their age above 45. Okay. So if you want to get PR visa permanently, if you want to settle down in Australia, so your age must be below 45 years of age. But if you clear this AMC part 1, you just want to work here for a few years and you want to go back to India, in that case, you can. There is no age limit for work visa.
Okay, sir. Thank you, sir.
Thank you.
Any other doubt from your side?
What is the fee for the examination for AMC and PLAB? Complete fee structure.
Sir, can you give the overall fee structures? Just
okay. So basically for AMC, around 3,000 you have to pay for this step 1 exam, and for English around 300 AUD, and for AMC part 2 around 4,000. So around 8,000 around you have to invest for AMC. Okay.
It's an AUD, Australian dollars.
This is in AUD, yes. But for PLAB around 2,000 pound. So it's going to be like 4,000 AUD, like 50% less than AMC.
So this 8,000 AUD is for both AMC 1 and AMC 2, right? Sir?
Yes. This is basically I'm telling the government fees for AMC part 1, AMC part 2, plus English, plus their documentation process around 8,000.
Okay. So the government charges for this AMC part 1, part 2 will be around, in Indian rupees, it will be around 4,40,000 for the government fees, your visa as well as exam application. Okay. So apart from this, academically is providing you preparation, right? Training as well as your English exam preparation. So we will be charging around 3,200 AUD for this, which will be approximately around 1.8 to 1.9 lakhs. So on an average, you could spend around 6.5 to 7 lakhs for the complete process. So like around 7 lakhs, it will be there. So you will be doing this step by step, not in single way. So initially you will be under preparation. Then once you are prepared, you will be applying the exam. There's a process called skill assessment. Once the skill assessment is completed, then you will be going to the exam application. Once the then you will be writing the exam. Then you will be going for the, once the exam result will be released, you will be going for the visa. So in every step, you need to, step by step, you will be paying. Okay. So total tenure might be around 6 months to 8 months period, to, starting from training to clearing the exam. So it takes around 6 months to 8 months. Okay.
Any other doubts?
So any other doubts, students? So anybody there? Doubts?
Thank you, sir. Thank you very much. Yeah. So now I would like to call upon Dr. Narayan Swami, Associate Professor, Department of Pharmacology, and a Placement Officer of AMC to deliver the vote of thanks.
Good afternoon to all. On behalf of AVMC Career Guidance Cell, it is a great honor and privilege for me to deliver the vote of thanks for this wonderful session. First of all, I thank Chief Patrons of this program, Honorable Chancellor Sir, Madam Chancellor, for providing these opportunities. And also, I thank Co-Chief Patron, Mr. Suresh Amal Sir, Member Board of Management, for constant support. I would like to extend my special thanks to today's speaker, Dr. Akram Ahmad, CEO cum founder, Academically Private Limited, Sydney, Australia. Thank you, sir, for sharing your valuable guidance with us with the simple and impressive words. I think this is one of the turning point of the students as, for who are eagerly waiting to settle in Australia or abroad. Thank you, sir. And also, I would like to thank our beloved Dean, sir, for his guidance and continued support for conducting this program. I would like to extend my thanks to MS sir, Dean HP Madam, and Provost. And also, I would like to share my special gratitude to Vice Principal Academic and Student Affairs, Dr. T. Rajan sir, the man behind the success of this entire program. I would like to thank participants of this program, CRMIs and final year students. And also, I would like to thank non-teaching staff, other people who all share their hand to make this program grand successful. And once again, I share my special thanks to Senior Manager of Academically Private Limited for Pondicherry as well as the administration, Mr. Abdul Razak sir. So once again, I thank everyone present here, and also thanks for all supporting the abroad for this session. Once again, thanks one and all. Thank you.